Hello, Dr. Burak.
Hi.
We are so happy to see you in our company.
Thank you.
Welcome.
Kind invitation for me.
Thank you. We would like to ask you some questions about your practice and your implant usage.
Okay.
I know that you are familiar with our products and you are using them currently.
Sure.
So, when would you use the short implants? And why do doctors choose short implants for their patient?
Yes, it's a good question. Also, I want to mention about my practice. In my practice, the short implant is called iStem. The use of the short-length implants allows treatments of the patients who are unable to undergo complex surgical techniques for medical, anatomic, or financial reasons. There's a high risk of complication. I mean, the inflammation of the bone, osteomyelitis, maxillary sinusitis, facial numbness, autoimmune diseases, bone graft rejection sometimes. We can see this kind of complications also. And the patients after care period can take years in some cases. Short dental implants were developed to minimize the above risk and reduce the patient's recovery time. And they have proven their effectiveness with delayed loads. What I mean that the use of the short implant is good alternative in my practice also. And the treatment plan with the short implants can also be used in age-related patients. The size of an implant used to be determined primarily by the existing bone volume in height, width, and length. The surgeon would select shorter implants in the anterior and posterior areas in the mouth if the limbs are big issues of the mandibular canal and maxillary sinus.
These are actually really good key points, and it is the real highlights of why we are using short implants currently during practice and clinical use.
Okay.
So another question is the implant shape. Does it really important for surgeons?
Yes, in our practice it's very important. Why it's important? I want to explain something also. The reason is design of the implants, a beveled neck and a larger surface area and tapered. I'm not talking about the screwed connection also, which has no micromotion in the implant abutment connection area. It has become possible to comply with a specific treatment protocol and implant outcome quality using the dental implants even in difficult situation with the development of the surface design of implants.
Thank you. We now can understand that the shape of the implant is really important for the surgeons.
Yeah, sure, it's very important.
But I know in some laboratory settings, doctors are using crown cementing. What do you think about that?
I want to say something about it also. If I describe something like this also, I think another advantage of the eye system is extraoral cementation of the tooth crown. Implants with the conical non-screw abutment fixation, the dentist gets the crown already firmly cemented to the abutment while in a dental laboratory or extraoral. Cementation in the mouth can lead to many complications. According to the classic scheme, cementing compound is applied to a crown and the crown is then put on the abutment and pressed down. The excess cement is squeezed out from under the crown while often getting under the gum. And this cement cannot always be removed correctly after the crown is fixed. The cement left in the mouth after placed crown is a serious prerequisite for the mucosal inflammation and bone destruction around the implant. I mean that it's periimplantitis also. This is the most common problem with conventional screw type implants.
Another really important question for the history of the implantology, doctors are trying to make some consensus about that. What is the difference between the short implant and long implant?
I think it's directly related with the design also. The reliable short implant designs will offer the most efficient way to overcome anatomical barriers with minimal invasiveness, greater safety, applicability by a wider range of the practitioners, and economic benefits for the patients.
Yes, it is also very true. Overall, can we say that short implants are successful?
Exactly. I want to just give the one sentence also. The survival rate of the short implant is found to increase the 98%. Not for me, all around the world also.
Thank you so much, Dr. Burak.
Thank you, Burak.
Thank you for coming. And these are really important questions, and thank you for your answers. I know that short implant, especially eye system, is a really important and really popular topic. all among the dental companies and dentists and doctors all over the world are trying to understand the mentality
Yeah, sure,
of
philosophy,
eye
mentality,
implant,
yeah.
yes, short implant and eye system.
Yeah.
Especially in some cases, they need to use short implant.
Yeah, because
it's the only option.
Yeah, we can't do the further surgical operation for every patient also.
Yes.
I explained the reasons also. Yeah, you are right.
Yes, it is really important. It is efficient.
Sure.
It is applicable.
Yeah.
Yes.
Yeah.
So thank you.
Thank you.
We are really happy to welcome you
Yeah.
here in our
I will
company.
see you next time also.
Yes, next
Yeah.
time we will
Yeah.
prepare some other
Yeah.
questions for you.
Thank you.
So thank you very much.
Thank you. Nice to meet you.